To talk about today is what is BDI? What am I talking about? Pharma BDI. I also exchange words with what is Pharma BDI, and then also what is the CRM system I keep talking about. It's one and the same. It is our customer relationship management system. I call it Pharma BDI because I'm very focused on the pharma, biotech, and diagnostic industry. So it is truly a powerful sales tool if you're willing to use it. And I know salespeople, we hate using systems. So I try to make this system easy. I'm the first one to be somebody who revolts and does what I'm not supposed to do. So I built this system with me in mind as the salesperson. It's a great sales tool. We have right now we have between 400,000 and 500,000 contacts in our system. We have 15 people in our back office validating this data. So you probably are surprised by that, because a lot of companies these days, they are putting CRM systems out there. They're asking you to update it, or they're not updating it. They're using news to push information to you. I actually have 15 people that are focused and dedicated on you, specifically on you. They know that they are there to make you happy. We even have some live communications back and forth real time. You can ask questions. You can ask for more help, assistance. We're really set here for you, and we love what we're doing. You're going to see how you can build and manage your own list in the system of companies' targets you're interested in, and then after the targets are encapsulated for you in the system, you can also find some other contacts from companies you may not even know exist. You can make phone calls to your targets, the prospects that are out there, and keep track of it in our system. And we also have news alerts that will come to you through the system. And I think that you'll find that it's nice that you're able to customize it. So you don't want to see news about everything because you don't have time to read all of that. But we're going to show you how to streamline your dashboard to get news about the companies you're most interested in talking to. So next, I'm just going to tell you what I'm going to show you in a few minutes, okay? So I'm going to show you how to organize your work queues. We want you to hop on, get going in the morning, make your calls, and then be done, and you can go work on those really cool projects that you're so interested in doing. Again, I know what it's like to have to make phone calls and be an effective salesperson. But let's face it, you've got to make the calls. So why not use a system that's going to make it as easy as possible for you? That's what I've done for you with this system. I'm going to show you how to utilize search to find prospects by any kind of category of information, by zip code, by city, by state, by title, by therapeutic area. You'll be able to build your own sales list and have queues that will take you right to the information. You don't have to think about, who am I calling again today? Who do I want to make sure I get to? It's all going to be there for you. So again, I did this with you in mind. And you'll also see how to track your leads. Things that you want to know how to do, I've put together for you. And so I hope you'll enjoy it. And if there's things you see that you think we could do better, this is a great platform to give your feedback to us as well. So why not work with us? Help us be the best thing for you, and in return, we'll do well by you as well. Okay, so let's get started. So what I'm going to do right now is take away the slideshow, and I'm now going to be able to show you. Welcome to Pharma BDI. So this is what your screen would look like if you were to be a happy customer of Sales Links. And what you'll find with our system is it's not something that you have to learn. It's hard to use. It's pretty intuitive. Because after all, it was built by a salesperson for salespeople like you. So I know what you're going through. I know how hard it is. I know you need time for other things, and you just sort of want to get your calls going. And I know salespeople, you do like to talk to people. So if everything's set up for you pretty easily, why not? You'll have fun making the phone calls. So let me kind of give you a roadmap to what you're seeing here. Left side is your buttons that take you through the system. Some of the buttons are probably self-explanatory to you. We're in the dashboard right now. You can do a prospect search, free search. I'm going to show you some of the cues later. Company search, free search. You do a news search. All of that is used by putting in a contact's name, a company, and the information will pop up for you. We have these work cues, which is our secret sauce. Okay, I'm going to show you quickly, and then I'm going to close it up. You have to stick with me so I can show you what those are about. But those are what makes this so easy to use. We have some other cues, keys here, buttons here. Campaign scheduling. If you're a corporate client of SalesLink, we actually do your mail campaigns for you. Yes, we actually watch what happens with email campaigns that go out. You probably heard the dirty words, blacklist, bounce. Well, you don't have to worry. There is a way to get out of those. And we have a team that takes care of that for you. So you get blacklisted, you can get off the blacklist, but you have to be really good after you get off the blacklist. But we have a fantastic team that knows how to do that, and every morning stays alerted to see if we are on a blacklist. You can't get out of it. This is the world we live in today, so you need to learn to manage it. We do that for you. The bounces, well, bounces will be bounces. You have to find the right emails. You can't have them all. But we use a lot of different tools like Hippo and Hunter to help us get the right emails. And we also have algorithms. We have a lot of good, cool things going on. We have a lot of crawlers, scrapers, all those things that you don't have to do because we're doing it. We also have calendars here, so you can put your information on calendars. We have a reports queue that if you want to do reports for your management, all of these are probably things you would expect to see. Here's something cool. We have a communications area where you're having a problem or you want to share information with us. You can use the support ticket. You can use the idea key. We love the idea key because we want to make sure that you're always saying, I got what I need from SalesLink, and we're here. And so why not use us to do this? I mentioned before the campaign request. If you want us to do the campaigns for you, we made it really nice here where you can put in the campaign name, the target titles you want us to pursue for you, therapeutic areas, everything. We really made it easy. So, and that was through the help of other users. We asked users what they wanted to see, and they were really great with giving us information back on what they wanted to see in our system. So again, I'm not kidding when I tell you, salespeople developed this system. So let's show our loyalty and use it to the max. And then, of course, we have a settings area, which everybody needs to have with any system. But this is where you start to make your life easier. In our settings area, we have this area here called prospect criteria. This is where you can actually set your system up to almost work on its own for you. So what we do is we give you an area to put in your target companies, the companies that you really want to get into that, you know, maybe your boss said, hey, I'd like you to get in there, get us in there. That's where you want to put those kind of companies' names. This way our system, Pharma BDI, knows that's what's important to you. And so therefore, you're going to see in a little bit how we collect all of the contacts for these companies, put them in one place for you, and get you started to make your phone calls. And by the way, this is also a nice system that if you have a staff that's working for you, you can actually come into this queue here, set it up, and basically tell your call center to make your calls through the work queue. It's kind of nice because you can restrict who you want them to call. You can exclude companies you don't want them to call. And you can basically plug into the system here the territories. You can also plug in the titles. And it sort of really contains what you want. And sure, you can talk to your staff and reiterate what you want them to do. But you know how it gets so busy and you're like saying, just make my calls. At least you have a system that you plugged in. You know, you might the night before you might have plugged in what you wanted, and it's under control. You can also put in the specialty or therapeutic areas you're interested in, the phase of clinical development the company is in, and you can also put in how many contacts you plan or would like to call from each company in a given day. Once you save that, that is all plugged into the system. And you're ready to go to see what the system will do for you, having plugged in some of your criteria in order to customize the system. So anyway, I just wanted to take a minute because I wanted to see what kind of comments people are making so far. I hope it's been so far fun, I guess, and that it's clear about what we're doing here. Just as a recap, we have a system, a CRM system here. It's built by salespeople for salespeople. It has over 400,000 contacts in the system. We have a 15-person office that is making sure the contacts are clean and are available to take questions from you, bring in your ideas. They take care of everything. So it's really nice. Somebody's asking here, what tools does BDI offer me to find out about a new prospect I come across? Well, I mentioned earlier that in our prospect search area here, you can very easily come in and just freely type in, you know, you met somebody and it's Peter from Pfizer, maybe perhaps, and you can't remember his last name, so you're saying, oh, let me come in here, and every Peter from Pfizer is going to show up for you. So you can also, you know, let's just go into one of our Peters from Pfizer, and if you wanted to get an idea of the kind of information that you would be able to see, you'll get their title, their location, their phone number. If we have a validated email, the email will be here, and we do have a lot of validated emails, but we don't want to give people, you know, we don't want you to get a dead end. So make a phone call, or you can go onto their LinkedIn and do an email on LinkedIn, okay? There's a place here that you're able to, you know, make an annotation after you call somebody or send them an email, and you can keep track of that. And then there's information on the system such as clinical trials and company news. So if you were to press these areas here, if there was, and there is information here that will pop up, but it's the clinical trial, company news, and the company detail information on each of the contacts. It's a great way to get ready for a phone call so that you have something to talk about. You might see some current news that came out just that day, and sometimes it's appropriate to mention to the person you're calling, and it's just timely, and it shows that you're really looking at the company and you're just sort of not randomly calling. Can I customize my search by specialty? Yes, you can. And one of the things that you will do is when we were doing the settings earlier in the prospect criteria area, you can basically tell the system that you want to look for companies that are maybe just working in metabolic. So if that's what you're looking for, you would set that in. You can actually do any therapeutic area that your company is focused on, you might say. So it's like I said, it's really a way to customize your searches for you. So, and can you recap what kind of support help you offer at BDI system? Yeah, thanks. That's a great question. So in our communications section, we have a number of ways that you can communicate with us. You can put in a support ticket. Support ticket could be something is wrong that you're not able to find something with the system, maybe there's a block on your internet, something from that perspective, or you need us to help you do some search, I'm fine. You can put it in the support ticket area. It goes to our department that we have somebody on for sure from 8 till 5. And we even have people on the weekends and evenings that are working. And so you might be lucky and get to talk to somebody on the weekend or the evening. And then we also have an area for ideas. As I mentioned earlier, this is a system that salespeople are building for salespeople. So your ideas are important, really important to us. Much of what we've done in the system already has been from great feedback from salespeople. And I have to tell you, it's a pleasure working and building something with like people. So I hope that answered questions. Let's see, it's 4:23. I promised only a half hour. So one of the things I think that's really important to show you right now is the secret sauce of our system. So I showed you how you go into the settings and you fill out your prospect criteria, the information that's most important to you, kind of people you're looking for, companies you're interested in, titles, therapeutic areas. So once that's set into place and you've said saved, you are then able to go to the work queues. These work queues are collecting information based on some of the information you put in the setting area. So, of course, most people say, I want to work on my targets first because somebody's going to ask me, did I get into such and such a company and how are we doing on that? So all the target companies that you put into your settings and the titles will produce a list here for you so that you can jump right in and get your calls done. So you can pattern your page to say, I always say I want, you can say I want the most people that it found on the page. And so this way, when I do my sorting, I can say, well, listen, I want to go by alphabetical order. And so if you want to go by alphabetical order, you want to get through the company Alexion today, you see the titles of who you're looking for. And what you can do is basically just kind of scroll down the page and decide who you want to call. So after you decided, you can plug right into the prospect's information here. If previously you had maybe secured a meeting with somebody, you could put a do not contact on a tag on them so that nobody contacts them, or you remember that you don't want to contact them again, or perhaps you're having somebody do your calls for you and you put a tag on there, don't call this person. It's right there in red, can't miss it. And again, you can get through your calls. You can plug in your contact info, the comments, everything that you need to plug in here. You can kind of come in here and say, look, I made a call and, I have to, it was a voicemail, couldn't move any further. I want to do a follow-up on next week with them. You save it. Now, note the name, Lisa. Okay, so we're going to save that. One of the other queues we have in here is a follow-up queue. And in here, we have Lisa down here on the bottom. Left a voicemail, and you're going to follow up on the 11th of October. So to me, having this queue available for me to just quickly go down and make calls is awesome. And then after you finish with your targets, we have queues for priority prospects. These are companies that have titles that you're looking for, and they also have the therapeutic areas. And so after you're done, perhaps with your target companies, you can jump in and do that. So more people to call and more things to look at. I also wanted to just mention to you that when you were in your settings, I was showing you how to do your settings. The companies that are your targets, you can also go into your news criteria here, and you can set what companies you want to receive information on in your dashboard about the news. Because I have to tell you, every morning what I do is I come on and I look at my news and I see what's happening with the companies I'm most interested in targeting. So I can show you here the news sources that we get our information from. I know you're all saying, oh yeah, good, they got that one, they got Fierce Biotech. All the ones that I've always used are now feeding information into Pharma BDI. So that when you do go to your dashboard, you will be sure to see information about companies and contacts, mostly companies, I should say, companies that you're interested in talking to. And you can put things in like the Boston, if you want to see Boston news, or you want to see funding information. If you have funding in there, you'll definitely get information about funds. See, I think I must have had one in because it says so-and-so's receiving funds for pain relief device. So I know, I get excited. I think this is a great system because we use it, and I've been very successful in getting business for customers that I work with. Last thing, I showed it a little bit earlier. You're going to have to do reports for management. This is a great way to come out here and say, I want to see all the work I did this week, the names of the companies, the names of the contacts, the dates, and you can basically plug in calls made. You can say, from which day to which day. So if you wanted to see from September, 1st through, you don't even have to put an end date, and you just want to display it. It'll show you the calls. You can also export it. So, that was a lot of stuff to say. I just want to take one more peek of questions. It's 4:29. I was a little late, but I want to make sure I get you guys off at 4:30 because I'm sure that's what you expected. Let's just see. It seems like a great way to keep track of your contacts. Yes, it is. It really is because you don't want lists and papers and notes and lists. It's what many of us end up doing sometimes, but in the end, to be organized, to be a great salesperson, you do need to have something that's reliable, that you can go to at any time. And by the way, we actually have a version of this that you can get on your mobile phone. It's called Text Leader. It's where we can forward leads to your phone. You might be at an airport, you might be driving, and you're like, hey, let me get a few calls in. It's a nice little feature with our system. We could talk about it next time. And I'm just seeing if anybody else has any other questions. And how does BDI help me organize my calls and contacts for the day? I think I answered it, so I hope you found it useful. Thanks again for joining us. Each week we want to do new things, show new features, talk about different things. So I think during the week we put out notices to join us. Please do. And if you'd like, send in questions ahead of time and we'll cover them for you. Thanks so much. I hope you have a great, productive rest of the week, and reach out to us if you're interested in learning more about Pharma BDI. And you can always get in touch with me, Susan W. at sales-link.net. And also social media is always running. And again, feel free to reach out. Thanks for your time today. Take care. Bye-bye.